The Cognivue test battery uses adaptive psychophysics to measure patient thresholds through a series of key cognitive domains, including motor ability, visual ability, executive function, perceptual processing, and memory. The operator begins the test by recording the patient's name, date of birth, gender, and education level, as well as the test language, and then selects Run Test. The patient initiates the test by turning the cogwheel 360 degrees. The testing begins with the adaptive motor control test. This tests a patient's fine and gross motor ability and uses their thresholds to calibrate the rest of the test to their individual pace. The next test measures the patient's visual capacity. The remaining tests are calibrated to accommodate the patient's actual visual ability by adjusting the size and contrast of all subsequent tests. The next 4 tests measure perceptual processing through 4 different domains, including letters, words, shapes, and motion. The letter discrimination test requires the patient to find the real letter among non-letter symbols. The difficulty of the test increases when the patient moves to the correct answer and decreases if they do not. Each test begins with 3 instructional trials, which allows the patient to transition from test to test efficiently and effectively. The word discrimination test measures the patient's ability to find the real word among non-words. As the difficulty increases, the amount of degradation added to the stimuli increases. The shape discrimination test measures the patient's perceptual ability to find the shape that is different from the others. This test incorporates irregular shapes that are not common, preventing patients from using verbal cues that are often associated with common shapes, for example, square or circle. The last perceptual test is referred to as motion discrimination. It tests the patient's ability to distinguish the motion pattern that is different from the others. The perceptual tests are capturing the point at which the patient can no longer respond correctly, otherwise known as their perceptual threshold. The last 4 tests measure the patient's memory in the same 4 domains. Each memory test uses the patient's perceptual score from the matching domain to determine what level of perception the memory test presents. The letter memory test initially measures the patient's ability to immediately recall letters, and as the test progresses, they are presented with an increasing number of masking letters. This is a technique referred to as backward masking. After the initial presentation of the correct letter, a series of incorrect letters are presented at varying sizes and periods of time. The word memory test follows the same pattern. As with the rest of the tests, it begins with 3 transitional trials before the test begins. Once the patient achieves a certain level of difficulty, the masking is introduced. The number and duration of masks presented is determined by the level of difficulty achieved by the patient. The word perception and memory tests incorporate the 30 most common 3-letter words. The next is shape memory, which measures the patient's ability to remember non-verbally mediated shapes that are unique to Cognivue. The memory tests incorporate immediate recall, attention, working memory, and simulated delayed recall with backward masking. The final test is motion memory. The patient is tasked with remembering a motion pattern and then finding it among other motion patterns. Cognivue uses 3 types of motion patterns: planar motion, which is left, right, up, or down; circular motion, which is clockwise or counterclockwise; and radial motion, which is motion from or to a focal point. Upon completing the test, a report is automatically generated. Cognivue is unique as the test is continuously adapted to the individual performance, allowing for a comprehensive, highly sensitive, and personalized test.